I'm going to go ahead and get started. Welcome, everyone, to the Missouri Open Door Benefits Series. This week's topic is the Master Plan on Aging. For those of you that join us on a regular basis, welcome back. For those of you that are new, welcome for the first time. I hope you enjoy our presentation today. Again, it's the Master Plan on Aging. This benefit series is brought to you in collaboration and sponsorship by the MIPA, which is the Medicare Improvement for Patients and Providers Act. And all three MIPA priorities are involved in this, MIPA 1, 2, and 3, through the collaborative partnership with Missouri SHIP and also the Missouri Department of Health and Senior Services, along with the UMKC Institute for Human Development. Missouri No Wrong Door is transforming the way people access services in the community, supports individuals and caregivers to make decisions on complete and accurate information about their options for anyone seeking long-term services and support, regardless of age, income, and disability. Through this Open Door series, benefit series, we focus on two main areas. We focus on the Missouri eligibility benefit series. That's all of your eligible services. And then we also look at the technology series. And the goal here is to integrate benefits, services, without disturbing the person or family coming in between them. So it's to integrate and make sure that services are received and that there's no barriers in between the family, the person, and the community offering the services. Yes, you will receive the slide deck um, after it gets edited. Um, Again, the series, we have the benefit series, and that is the second Wednesday of every month from 12:30 to 1:30 Central Standard Time. And then again, we do offer the technology series, which is the fourth Wednesday of every month, 12:30 to 1:30. And our next technology series will be November 19th with the topic of caregiving for memory loss. We will have the benefit series going into the upcoming year and 2026, and those dates and topics will be released to you soon. Of course, we have to give a plug for our upcoming showcase, the 2026 upcoming showcase. It's 10 years of charting the life course, so please register today. We'll be taking a look back at the decade of growth and how it's impacted the community by using the charting the life framework and its principles to drive meaningful change in people's lives. We'll also be exploring how this person-centered approach helps individuals, families, and programs and systems to explore, plan, and problem solve. So if you have not registered, please register before December 31st. That's the early bird registration. The actual showcase will be May 5th through the 7th here in Kansas City. Hope to see everyone there. It's going to be a blast focusing on these 10 years of growth, folks. At this time, we also have a call for presenters. So if you are using different Charting the Life course principles and tools in your life or at work, please register to be a presenter. If you are supporting a diverse population across different stages, we're looking for you. If you're driving change within your organization, within the state, within the community, we're talking to you. Come be a presenter. Give us your ideas, share with us, share with others. Please submit your presentation by November 21st. And if your presentation is selected, we'll notify you by December 19th. Oh, and this is also a call for sponsors. So if you would like to be a sponsor, an exhibitor at the showcase, please register now. It is a great way to connect, collaborate, and to learn and to share what you're doing, what you've got going on at your agency, within your organization. So please scan the QR code and register to be a sponsor or to be an exhibitor. Today, we are very pleased to have with us the recently promoted Director, Bureau Chief of Senior Programs, Ms. Kristen Davis. She'll be presenting for us today. So if you would, please welcome her and sit back and get ready to learn a lot of information.
Thank you, Deshawn. Yes, you like to stick that recently promoted thing in there frequently, don't you? Okay, well, thank you and welcome to this benefit series session. As Deshawn said, my name is Kristen Davis. I'm the Deputy Bureau Chief for the Section and Senior Programs at the Missouri Department of Health and Senior Services. And today I'm just going to be talking a little bit about where we are on the master plan on aging and how we are going to move forward. Our office is in charge of the development of that plan. So we kind of are the gurus for that. So I have a lot of information to share. There will probably actually be more information on the screen than what I will talk about. We were just trying to give you kind of as much information as you could get. We will be sharing the slides afterward. So, after Angelina and her team get everything together, they will send that out. So, feel free to take notes or not because you're going to get the information later. So let's get started. Today on our agenda, we're going to discuss why there's a need for a master plan on aging, and then kind of share with you some information we have about Missouri's aging profile and the background information about developing the master plan on aging. And then we're going to jump into the plan itself and kind of look at the recommendations and action items for the different sections and cross-cutting recommendations across all of the different areas that we looked at, and then some next steps for implementation. Next slide. And you can go ahead and go on, Catherine. So the question is, why do we need a master plan? And basically, we are all aging. Missouri, like the rest of the nation, is aging. And the data shows that by 2034, for the first time in US history, there will be more older adults, adults over 65 than there are children under 18. And that disparity is just going to grow as time goes on. As we move past 2034, where it's going to be a larger proportion of the population, and we need to prepare for that change so we can best support aging adults so that they are able to live in the environment of their choice for independently as long as possible. And so we are working on this plan to ensure that all Missourians can age with dignity. Next slide. This initiative started in the beginning of 23, January 23. Governor Parson issued the first executive order of the year and put together a plan for aging with dignity. And there were several different key points in that executive order that as a state, we needed to review and assess the current state of what aging services were. And we needed to coordinate and complete at least 10 sessions around the state so that stakeholders could give input on their experience with aging and what they are, how they're planning their future and what they see their needs are. And then also conduct a statewide needs assessment for older adults and adults with disabilities. Establish priorities for each state agency, and then be able to communicate those priorities to the stakeholders across the state, and then ultimately develop that master plan on aging. And so that plan is due to the governor's office on December 31st of this year. Next slide. The state already completes a state plan on aging, which some of you who are in the network or tangentially associated with the Aging Network might say, if we already have a state plan on aging, why do we need a master plan on aging? Well, the state plan on aging is a 4-year plan, and it is mandated by the federal government as part of compliance with the Older Americans Act. So that plan is specific to Older American Act services and the stakeholders within that particular area. Whereas the master plan is a 10-year kind of a playbook for looking at all areas across the aging spectrum, and it gives a much broader focus. We can focus more on those with disabilities, with family caregivers, and it covers things that aren't necessarily covered by Older Americans Act. And also access to health care, which is that is age and disability friendly, which also is outside of the Older Americans Act. Okay, one more, Catherine, please. As you can see on the chart, individuals aged 65 and older will become one of the largest groups within our state. Missouri's aging population and changing demographics can be attributed to several factors, including the aging baby boomer generation and longer lifespans due to medical advancements. While longer life expectancy is encouraging, it does come with an increased risk of chronic conditions and continued needs for support. So as Missourians, next slide, please. As Missouri's older adult population continues to grow, it's also important to understand the challenges facing older adults today in maintaining health, independence, and their quality of life. To date, Missouri has more than 1 million adults over the age of 65. And of those, 97,505, which is a little more than 9%, live below the poverty level. 56% of Missourians 65 or older are at risk for social isolation. And additionally, many older adults face rising housing costs exceeding 30% of their income. And 136,179 Missourians have difficulty living independently. While life expectancy has increased since 2021, the state continues to fall behind national trends with a life expectancy of 76.6 years compared to 77.5 years nationally. The figure on the screen shows a current snapshot of aging in Missouri using data from the U.S. Census Bureau's 2022 American Community Survey. It highlights some key challenges that Missouri seeks to address through the Master Plan on Aging. The quickly growing aging demographic includes people who are aging with lifelong support needs, as well as those who experience disability for the first time. More than 1.5 million adults in Missouri self-report as currently living with a disability. That's about 1/3 of the population. This means that over the 1/3 of adults who report having a disability, that's higher than the national average of 28%. Adults living with a disability are more likely than those without a disability to report depression, obesity, smoking, diabetes, heart disease, and long COVID, as seen in Figure 5. Understanding these intersecting needs is essential to planning for increased demand for services and supports across the state. Next slide. This map of, one back, I'm sorry, Catherine. The map of the state of Missouri shows rates of independent living difficulty for people 18 years of age and older by county. Rates are broken into 4 categories ranging from 2.7 to 14.2%. The 5 largest urban areas, you see Kansas City and Lee Summit, Columbia, St. Louis, and Springfield, are labeled on the map to show the differences between rates of people with independent living difficulty in urban compared to rural areas. Columbia, St. Louis, and Springfield are in counties with lower rates of 2.7 to 6.1%, and Kansas City and Lee Summit are in a county with the second lowest rate of 6.2 to 7.3%. This map was produced in April 2020 based on the 2013 to 2017 American Community Survey data. Next slide. As Missouri's population continues to age, so do individuals providing care. Today, nearly 60% of Missouri's caregivers are over age 60 themselves. Most are family members who often juggle their own health challenges while supporting loved ones with complex needs. According to the AARP Public Policy Institute, 2 out of 3 older adults rely solely on family caregivers for their caregiving needs. In 2021, approximately 38 million family caregivers in the United States were estimated to provide 36 billion hours of care to adults. While much of this work is informal and unpaid, family caregivers provide an estimated $600 billion in economic value for their unpaid contributions. 3 out of 5 family caregivers are actively employed in the workforce while caring for family members with serious health conditions or disabilities. As a result of these challenges, family caregivers are at risk for chronic stress, emotional hardships, and financial effects. These impacts of caregiving are even more prevalent among resource-limited populations. Next. 99 of the 115 counties in Missouri are considered rural. 2/3 of the state's older adult population lives in urban areas, those in teal on the slide, and the other 1/3 of older adults live in the rural areas, which are shown in yellow. Aging populations living in rural areas experience decreased access to resources and have fewer connectivity options than those in urban areas. A 2011 county-level study in Missouri indicated that a higher percentage of Missourians age 65 plus living in rural communities lacked access to nutritional foods and health care and had a higher incidence of chronic disease than those who lived in urban areas. The 2020-2021 Health in Rural Missouri Biennial Report found that Missourians of all ages living in rural counties experienced greater health gaps than those in urban counties. These health imbalances often lead to worse health outcomes for Missourians in rural areas. Rural residents in the state also reported having increased difficulty accessing health services due to distance, the shortage of healthcare providers, and low rates of insurance coverage and cost than their urban counterparts. Next. So let's talk about developing the master plan on aging. As I mentioned before, we kicked off that work in January of 23, and the final plan will be submitted to Governor Kehoe by December 31st of this year. Missouri's Master Plan on Aging process was unique in the deep amount of public engagement that informed the plan. Community engagement and stakeholder outreach were central to the Master Plan on Aging development process. Hearing directly from older adults, individuals with disabilities, and family caregivers allowed the state to better understand the unique challenges these groups face and how to help them live healthy and safe lives as they age. Next. Each of the activities on this slide was mandated through the executive order. First, we developed an advisory council consisting of directors of each cabinet-level department or their designee, along with experts from statewide organizations that focus on older adults, adults with disabilities, or barriers that affect those populations. Next, we developed 7 subcommittees to focus on known areas of need for older adults, adults with disabilities, and caregiver populations. And we'll talk a little bit more about those subcommittees a little bit later on. Then we did a scan of known available needs assessments from the state, which were completed by area agencies on aging, centers for independent living, community action agencies, hospitals, and others, to show what needs that had already been identified through those efforts. Each cabinet level department also submitted information on programs and services they provide older adults. These were reviewed for gaps and potential service overlaps across the different departments. From February of 23 through the first full week of March, we held 10, and that was in 2023. We held 2024. There were 10 in-person town halls, one in each of the Area Agency on Aging regions. We also worked with the Missouri Association of Area Agencies on Aging to procure a vendor to administer a statewide needs assessment. And this assessment ran from June through mid-December of 2024. And finally, we completed a media campaign to get individuals to complete that survey. Throughout the process, it was determined that there were not enough individuals with lived experience who were involved in the drafting of the master plan. So there was an ad hoc lived experience advisory committee added to help keep us honest in our work. This committee was made up of older adults, adults with disabilities, both physical and intellectual and developmental disabilities, and caregivers. We utilized this committee to keep us on track and ensure that we were considering lived experience as we move forward with the planning of the Master Plan on Aging. Next slide. The Department of Health and Senior Services led the work, but there were so many others that got us to where we are today. We contracted with Alvarez and Marcel, a consulting group, to help administer the master plan, and we would not have reached our current state without their leadership, help, and support. We had the advisory council, which we will talk about a little bit more, and there were 7 very hardworking subcommittees. These subcommittees committed almost 2 years of ongoing work to ensure their final recommendations would be the most appropriate to meet the needs, wants, and desires of Missourians as they age. And you can see those 7 subcommittees are listed there, and we'll go into those a little bit more in depth as well. Next slide. We also reviewed and built on a lot of the work that was already going on across the state. We were very intentional not to ignore or duplicate programs and services that were already taking place in Missouri. Next. I mentioned the town halls that took place in February and March of 2024. As directed in the executive order, there were 10 in-person town halls, one in each of the AAA regions. And then there were also 2 virtual town halls that were held for those who could not attend one of the in-person sessions. In total, there were 311 volunteers helping with the town halls to ensure we captured all comments that were made. As you can see in the photos, these were working town halls. Participants broke into groups and were paired with a leader and a note taker and worked through the 7 different subcommittee areas. In total, we had over 1,769 individuals participate in the town halls, and we ended up with over 15,000 comments, which were provided to the advisory council and the subcommittees to use in the development of their recommendations. Next. Some key takeaways that were identified in the town halls include transportation of all kinds with an emphasis on mobility management, safe and affordable housing that people can age into, funding to retrofit housing for those who want to age in place, a no wrong door so people can find the services they need, education and outreach about currently available services and programs, safety and security around financial scams and concerns with AI scams in particular, and caregiver supports and services. Next. So, statewide needs assessment survey. As instructed by the governor's executive order, there was also a statewide needs assessment. This needs assessment ran from July to mid-September of 2024. We ensured that a survey was accessible on the website, but also offered to have it available by phone or in person. In total, 7,621 surveys were completed by Missourians. And the data was put together by a contractor, Polco, to provide additional information for the subcommittees to use as they developed their recommendations. The data is and will remain available on our website for others to use to develop their own programs and services. Next. As far as the Master Plan Advisory Council, it was comprised of 40 members and brought together individuals with extensive expertise in aging and disability needs. Its members included state legislators, agency officials, executives for local nonprofits, associations, foundations, educational institutions, and private entities. Organizations represented on the advisory council included the Area Agencies on Aging, Missouri Council for Aging, Missouri AARP, the Centers for Independent Living, Missouri Foundation for Health, and the Institute for Human Development. The Advisory Council held quarterly meetings throughout the drafting process to hear updates on subcommittee activities and provide high-level guidance. Next. And before I mentioned that Ad Hoc Lived Experience Advisory Council, that was put into place at the suggestion of one of the suggestions that came out of the town halls to ensure that we were hearing directly from those with lived experience. Next. These are the subcommittee areas for the master plan. There are 7 subcommittees, and each group worked hard over the last 2 years. In the next section, we will discuss their visions they developed for Missourians as they age, as well as their recommendations and action items. Next. This slide contains a listing of all the vision statements and key priorities for each of the 7 subcommittees. It is small, and don't worry about reading it. We'll have individual slides that have them in a little more accessible format, but I just wanted you to have them in one place in case you would like to kind of compare across the different subcommittees. Next. So each action item in the plan is labeled with kind of a level of effort. And that so the lower level are labeled L, and those are kinds of things that can be done as we are. It doesn't necessarily take legislative action or extra funding. We can do a lot of the L items through collaboration and education, and kind of expand on the work that is already happening. Medium effort actions, labeled M, require coordination across agencies or partners. There might need to be some sort of resource allocation to that. There might need to be some programmatic changes, but within the structures that exist currently, those changes are achievable. And then we have the complex actions, and those are marked with C. Those are the ones that require a new legislation item to be passed or large-scale funding, major system change. It must be implemented over a number of years, or it requires a large number of stakeholders to come together to engage to get that done. And then also, we have identified some crossover between the subcommittees. So we have abbreviations for each of our 7 subcommittees. And you'll note in the plan that after some of the action items, there will be an item DLE. So in the transportation section, you might have an action item, and then it also says DLE, which means that that would also benefit the daily life and employment. And there was some crossover between those 2 areas. Next slide. Our first subcommittee is daily life and employment. And you'll find that we go through these alphabetically. So not one is necessarily more important or has more action items or anything like that, just an alphabetical putting them forward. The vision statement for daily life and employment is Missouri is a national leader and center of innovation in engaging all people, regardless of age, ability level, or personal circumstance in employment, volunteerism, and community participation. And community participation opportunities strengthen their social civic ties and enhance their sense of purpose in daily life. Each recommendation in the Master Plan on Aging has a list of action items underneath it. Each action item has been designated with that low, medium, or complex effort. And then in addition, they might have those cross action items. So the action items not only have an effort level rating, but are marked to show what other subcommittees had similar recommendations. So daily life and employment had 9 action items, and there were over 200 action items across the master plan. So we're definitely not going to be able to jump into them all, but I kind of want to give you a high level overview of some of what you might see. So a recommendation: reimagine volunteerism and promote civic engagement for older adults through cross-sector partnerships. So some of the action items under that recommendation could be convey the capacity and potential of older adults as volunteers by partnering with nonprofit organizations to promote awareness of the valuable skill, experiences, and passions older adults bring to service roles. Could also, one of the other items was encourage organizations to adopt a buddy system that pairs older adult volunteers together to reduce social isolation, promote social connection, and provide mutual support. A third, encourage employers to provide information on civic and volunteer engagement opportunities to those individuals who are preparing for retirement. Along with some of the action items that are listed, where there were best practices, we also tried to include those. And in this section, Give 5 is a free volunteer engagement program that had its beginnings in Springfield, Missouri, and it matches retirees with local nonprofits based on their skills. Nonprofits kind of do a sales pitch to potential volunteers, and that way the volunteers can see what particularly resonates with them. And by going through the Give 5 program, they agree to give 5 hours per month to the organization that they select. So it benefits the nonprofits in getting more volunteers and increasing their capacity to carry out their mission, but also helps the older adults and volunteers in that they're maintaining skills and they're gaining that isolation, combating social isolation, and then also making connections with other folks in the community. Next slide. A second recommendation is strengthen employment access and economic stability for older adults and adults with disabilities. There were 12 action items under this one, some of which include inform employers the value of hiring, developing, and retaining older workers and workers with disabilities. Review existing earned income and asset caps for all state-provided benefit programs to determine if changes would increase employment opportunities for older workers and workers with disabilities, and then enhance programs that educate beneficiary recipients on the impact of additional employment income on their benefit levels. And here's an example of a promising practice along that lines. Missouri Disability Benefits 101 is an online tool where an individual can put in employment income to see how that might relate or might affect any benefits that they receive. So that is one of those things that they're not finding out on the backside, that I got a job, but the pay is such that it made me just over the income limit for some of the benefits that that person relied on, and they lose those benefits and actually leaves them in a worse position than when they started. So this can kind of help get on the front end of that. Next slide. We're going to go ahead and skip this slide and jump to the next one. Family caregivers. The vision statement for the family caregiver section was that family caregivers in Missouri will have knowledge of and access to adequate training and resources to provide effective care, supporting the care recipient's choices and their own physical and mental well-being. Next. Okay, some of the recommendations here to increase access to caregiver resources and innovative community-based supports. And there were 4 action items under this. One of which was to create and socialize a comprehensive list of resources available to family caregivers of all ages and across the lifespan to both consumers and professionals to ensure inclusion of respite and care alternatives and identify and include requirements for federal, state, and or organizational benefits. Another recommendation was to invest in the caregiving workforce to better support families. There were 6 action items here, such as leverage and centralize available training and education for professional care providers and family caregivers to improve care, and consider innovative workforce strategies such as thorough and paid training, providing transportation to client sites, full-time employment, expanding benefits, and guaranteeing a minimum number of hours or advancing pay in emergencies. Another recommendation, support working family caregivers across employment sectors. And for that, there were just 2 action items, which were promote caregiver employment supports for all, recognizing potential differences between jobs that require in-person attendance, for example, healthcare, food service, and remote or flexible roles. And then the second was incentivize public and private employers to support family caregivers in remaining in the workplace through innovative models to support family caregivers through tax credits, family leave or bereavement policies, additional flexibilities, and to consider hurdles based on employment site, required in-person attendance versus remote. And then the last recommendation under family caregivers was strengthen support for kinship caregivers. And those kinship caregivers are those who are caring for children under the age of 18, and that is a growing population within the caregiver community, and are often overlooked in formal systems. There was 1 action item under that recommendation, which was to allow funding for support of kinship caregivers providing care outside the formal foster care system, including but not limited to legal services, financial assistance, and respite care. Next slide. Okay, we have housing and aging in place. We envision Missouri as a state where every person has access to safe, affordable, quality, accessible housing suitable for all ages and abilities in a caring community that provides necessary support and services to meet the needs of all citizens. Next, please. Housing was an area where there were many recommendations and action items. So I'll just touch on a few. To develop a state oversight agency appointed by the governor. And the idea with that is that many of the housing and aging in place action items necessitated a number of agencies having a hand in carrying those things out. So having a high-level executive leadership enables accountability, cross-sector collaboration, and a unified strategy to help Missouri residents age safely and independently in their homes. And so part of that would be to appoint a deputy cabinet secretary or some sort of special counsel with cross-departmental authority to oversee and execute the recommendations that the Housing and Aging in Place Committee had. And then another is focus on finance and funding. And that would be an example, increase state and local funding available to support affordable housing services, development, particularly funding for home maintenance, modifications, and repairs, and redirect housing funds to incentivize developers to invest in affordable and accessible housing. And here we have an example of a promising practice. And this happened in Moberly, Missouri. Moberly Junior High School was a building that had been vacated and a different school was built. And so this one was no longer being used, and it was repurposed into senior housing. So the idea that we can take existing structures that have been vacated for whatever reason. A lot of people in our town halls mentioned strip malls or old warehouses that could be converted into affordable housing, that could be fit for older adults or adults with disabilities. Next, please. Let's go one more. Thank you. Conduct public education and awareness campaigns. Under this, there were 11 action items. Awareness of available resources is often the first step in accessing support. Education and outreach tailored to tenants, landlords, and communities can help expand the understanding people have around housing rights, financial supports, and accessibility options. These efforts build on existing work and can play another key role in helping Missourians make informed choices. And some of those action items were to ensure organizations are providing essential and connective services to individuals who are aging, individuals with disabilities and their caregivers, and are aware of funding sources. To provide an education campaign around renters' rights and how to get legal assistance for the defense of eviction. Americans with Disabilities Act requirements of landlords and renter expectations. And then also, as part of the No Wrong Door organization, create a one-stop shop with aging media resources, tools, and plans to be used by the cross-departmental task force to communicate Missouri's affordable housing needs and resources. And all of those resources and documents would be housed in one site to make it easily accessible. Next slide. Under long-term services and supports, our vision statement was Missourians will have the knowledge and resources to make informed and person-centered choices regarding the setting in which quality long-term services and supports are available for delivery, including individual home and community-based services and congregate care options that maximize independence, health, and quality of life. And in this section, informed choices begins with advanced planning for the LTSS care, which has a direct impact on the affordability of that care. Therefore, the committee made recommendations that will enable Missourians to make LTSS decisions prior to needing such services due to aging, disability, or life-altering event, and utilize the financial arrangements that improve affordability for those long-term services and support options. This committee had 4 action items, which included educating professionals and the general public about who pays for long-term services and supports now, including the limitations with current Medicare programs, and that is both traditional and Advantage plans, with reference to long-term services and support coverage. And then explore and develop new long-term care tax credit, savings models, and/or investments that incentivize consumer contributions with associated match. And an example there would be that Washington Cares Fund, which is a publicly funded long-term care insurance program where workers can put funds in, but those are matched up to $36,500 in lifetime benefits. And then that can be used toward long-term services and support as that worker ages. Next. Okay, Missouri's investments in its current array of long-term services and supports must be maintained while finding opportunities to increase the quality of care provided. This includes supporting provider reimbursement rates of Medicare, Medicaid, long-term services and support across settings. That's home, community, and congregate settings, including sufficient caregiver wages to maintain competitive with market conditions. And it also requires continued funding to support additional Medicaid waiver slots to appropriately serve individuals as they age and to avoid wait lists. So the committee recommends actions to enhance existing Medicaid home and community-based services and enhance existing monitoring and quality assurance of the LTSS in a congregate setting. There were 12 action items here. Let's see, build and enhance value-based payment options to ensure quality care driven by positive outcomes. And then invest in additional state surveyors of long-term care facilities at competitive wages to address the needs for increased regulatory oversight and growing complaints. Go ahead and jump the next two, if you don't mind, to get to safety and security. Perfect. Missourians will have education and resources available to keep them safe and free from abuse, neglect, and exploitation, and to help them plan for their financial security in retirement. Next slide. Okay. Strengthen legal protections against abuse, neglect, and financial exploitation. The subcommittee recommends revising statutes to close legal gaps, improve enforcement, and provide clear guidance for professionals and families. Priorities include updating adult protective services laws, strengthening power of attorney statutes, and enhancing penalties for crimes targeting older Missourians. So this recommendation had 5 action items, among which were to strengthen and update older adult abuse statutes, including but not limited to those governing adult protective services, mandatory reporting and penalties for abuse and neglect, and criminal offenses that are related to theft, fraud, and exploitation of vulnerable adults. And then also another was strengthen and update power of attorney statutes and make power of attorney resources available and more robust in all areas of the state. We have a second recommendation on this. Many professionals and mandatory reporters, especially those in financial institutions, healthcare, and law enforcement, could benefit from clearer guidance and tools. Training should be accessible and tailored to real-world situations that professionals encounter. Raising expectations for accountability and equipping professionals with the right knowledge can help enable timely, appropriate intervention. So under that particular recommendation, there were 5 action items, and it centered around educating law enforcement and first responders on how to respond to individuals with dementia, developmental disabilities, or other cognitive disabilities where people have communication challenges, and then also to educate law enforcement and first responders on how to report and prosecute cases related to adult abuse, neglect, and exploitation, excuse me. A promising practice here is that Missouri is actively expanding the adult and disabled MDTs, which are multidisciplinary teams, which brings together professionals from across a wide variety of groups to coordinate responses. So they're increasing professional development with each of those people and having a coordinated effort to address issues. Next. Improving how Missouri collects, shares, and uses data across systems is critical to identifying safety risks, targeting resources, and driving meaningful change. The Safety and Security Subcommittee highlighted the need for better coordination among government agencies, financial institutions, and community partners to detect patterns of abuse and exploitation, strengthen preventative strategies, and streamline responses. Leveraging tools like AI and screening frameworks while also expanding access to public-facing data and resources will support a more informed and proactive safety infrastructure statewide. So action items related to this were explore radar card expansion and or develop screening questions to improve financial safety. The radar card provides resources and information to law enforcement who may interact with an older person or a person with disabilities. And you can develop and adapt the radar card for other stakeholders and those who are in contact with older adults and adults with disabilities. Next, transportation and mobility. We are going to kind of go through these last couple pretty quickly as we're starting to run short on time. For transportation, Missourians will have access to safe and reliable transportation and mobility options so they can get to the places they need or desire to go. And so under our recommendations, we have support state investments in transportation infrastructure to leverage federal funding. And action items along this line were to continue investment in METAP, which is the Missouri Elderly Handicap Transportation Assistance Program, to cover a portion of transportation costs incurred by agencies who are providing the mobility services to older adults and to adults with disabilities, and to increase state funding for public transit to align closer to our neighboring states to reach an average of $3 per capita to ensure Missouri public transit is more adequately funded. Next. Let's go one more. Thank you. Improve or implement programs to assist with vehicle and driver shortages. So reliable transportation services really depend on the vehicle availability and trained supported driver workforce to address the maintenance, procurement, workforce compensation, and insurance challenges will strengthen the state's transportation infrastructure and resilience. And ways to do that include explore opportunities for transportation insurance cooperatives or other strategies that reduce costs for programs that rely on volunteer drivers, and work for the passage of the Volunteer Driver Tax Appreciation Act to increase charitable mileage reimbursement from 14 cents to the IRS business rate. And let's forward ahead to whole person health. Thank you. Missourians will have access to the care and services needed to help them live a safe, healthy life with maximum independence as they age. And this subcommittee focused on the interconnected domains such as physical health, behavioral health, cognitive health, nutrition, physical activity, and social well-being. They looked at factors like stigma, isolation, health literacy, and access to preventative services and how that might impact one's overall health. Their work considered both systemic gaps and community level opportunities, identifying practical recommendations that could be implemented through communication campaigns, community partnerships, and low impediment wellness programming. The subcommittee prioritized solutions that could help hard to reach populations, especially those in rural areas, and promote whole person support for healthy aging across the state. Next. We have several recommendations. Improve access to healthcare services and screenings, and this includes recommendations for increased coverage of services by health insurance organizations. Under that could be addiction and overdose prevention measures, cognitive health screenings, fall risk assessments, hearing screenings, mental health screenings, suicide prevention measures, vaccines, and vision screenings. And then in the recommendation to increase access to and availability of programs that promote health and wellness, there are 11 different action items there which promote websites and apps that provide educational programs, cognitive games, and safe social groups for older adults to join, or create more flexible fitness offerings for older adults who are caregivers for children, grandchildren, or family members with disabilities. Next slide. One more. And I mentioned earlier, we have some cross-cutting priorities, and these are things that we want to address regardless of the sub area. And those are navigating services. Missourians need clearer, coordinated pathways to access support, the workforce shortages and addressing those, supporting caregivers, accessing housing and transportation, accessing health and support, and communicating and public awareness. Next. As most of you are familiar with, we have a No Wrong Door initiative and trying to address many of these things through that no wrong door perspective, where citizens can call with an issue, and no matter who they call, that person can be connected to the appropriate service with a warm handoff, and don't have to go bouncing from phone number to phone number to phone number to eventually just give up because they feel like there isn't an answer. So UMKC has been integral in that process thus far, and we are continuing the work for that. Missouri was just awarded the second grant to continue this work, so it will be forthcoming. Next. One more. So our next steps for implementation. DHSS is developing a dashboard. ACL, which is the Administration for Community Living, has a strategic framework for a national plan on aging. And the hope is as that is more fully developed and fleshed out, there will be federal policy and perhaps additional funding on the federal level to address some of these issues that our master plan has brought forth. And while this plan was developed by the Department of Health and Senior Services, it is absolutely not a DHSS plan. It is a plan that anyone in the state can use, including all the information that was gathered through the town halls and through the assessment survey, the needs assessment survey. Anyone can use that information to develop their own initiatives. Next. As the master plan was sort of wrapped up, DHSS conducted additional town halls, both in person and virtually, and through the middle of August of this past year of 25. And those comments can be found on our master plan on aging website. There was an open comment period from August 15th to September 14th. And based on those public comments, those are also on our master plan page. Those were folded in to the final draft, which is kind of going through its final iterations right now, with it being submitted to Governor Mike Kehoe by the end of this year. Next. So I mentioned that data dashboard we are working on to continue to have transparency and show progress on initiatives that are being worked on. And then also there is going to be a local implementation guide that can be passed around for any local government, businesses, nonprofits, citizens groups that want to kind of put together their own action plan to address some of these issues that they see in their own communities as well. Next. So finally, I mentioned the Master Plan on Aging webpage a couple of times. It is at health.mo.gov/aging. And here you can find all of the county aging profiles, the town hall comments, the needs assessment results, and as we go forward, there is a feedback section at the bottom. You're also always welcome to add that. I see Stacy added in the comments, when will the subcommittees meet again? At this point, I am not sure that the subcommittees will be meeting again, because the work on the actual plan is done. There could be some opportunities kind of once that goes to the governor and based on what the governor's initiatives are, to maybe get some of those committees back if there are specific areas that we see that we can help to kind of connect people. But I don't believe that there's a formal plan, since we're kind of to the end of that 3-year space. The next slide. And that is all. I apologize for running over 2 minutes. If you have any questions, feel free to reach out to myself or Mindy Ulstad, either by email or by phone number. So I am happy to stay on to answer any questions, but I hate to keep you longer than necessary. Thank you very much.
Kristen, we'd like to thank you for taking the time to walk us through that. As Kristen said, we are out of time, but she is willing to stay on and answer any questions. So if you have any questions, please feel free. Don't feel rushed. Other than that, have a great afternoon, everyone, and we'll see you next month for sure.
Thank you so much. And thank you for having me.